to Dr. Deepak Puri, most innovative cardiovascular thoracic surgeon of the decade.
Every person who's been on today, it's a pleasure being amongst all the achievers. Congratulations, thank you so much.
It is seen that there were various trials. The most important was the Syntex trial, in which 64 centers from Europe and 27 centers from US they participated, and now we have more than 10-year follow-up of that trial. And they found that they did a scoring of the disease, and they found that those who have a mild disease, like score less than 22, they can either be stented or bypassed, but there's no difference in the long run. But those who have a score of more than 22 to 32, so these are at moderately high risk, so they should always go for a bypass. And if the score is above 33, then they have no role of stenting, and they should go for a bypass, because bypass gives a better long-term survival and it is less risky. But people think that maybe bypass is more risky, but actually all the scientific data shows that it is not more risky in these patients. And it is seen that still, because every 2 years the guidelines are updated, but still most of the people in India, 70% of those who needed a bypass, they are opting for a stenting because they feel that stenting is less risky. So therefore, in 2011 itself, we promoted that heart treatment should be done by a team. We modified a few techniques also. Like we do the beating heart surgery on patients with acute myocardial infarction and who have a low pumping. So for that, you need to modify the conventional techniques. And even the American Heart Association has recognized that if we do a beating heart bypass in these patients who have a low pumping and who have acute myocardial infarction, then the outcome is better and the risk is less. But for being able to perform these techniques in a critically ill patient, it is not as easy. So if their ejection fraction is low, if they are diabetic, and if they have a multiple vessel disease, they should go for bypass surgery. On the second post-operative day, and patient was able to walk more than 10 kilometers after 1 month. So these are less costly options and less risky options. So the total cost of bilateral lung transplant quoted to these patients was somewhere around 2 crore rupees. But we could do this procedure in just 2.5 to 3 lakh rupees. So that is 100 times less cost. So we have been, over the last 15-16 years, we have been trying to develop simplified techniques which can be used for complex diseases and complications, so that we can offer easily accessible and cheap treatment to the patients. And I would also like to tell you that every opportunity we get, we always share all these facts, because awareness is very important. Because in the medical fraternity also, like different specialties, they don't have awareness about other specialties.
नमस्कार, सिटी चैनल न्यूज में आपका स्वागत है। चंबा के लिए आज एक बेहद गौरवपूर्ण और बड़ी खबर सामने आई है। चंबा के मूल निवासी और देश के सुप्रसिद्ध हार्ट सर्जन डॉक्टर दीपक पुरी को नई दिल्ली में आयोजित नेशनल लीडर्स समिट में मोस्ट इनोवेटिव कार्डियोवैस्कुलर एंड थोरैसिक सर्जन ऑफ द डिकेड, यानी इस दशक के सबसे इनोवेटिव दिल और छाती के सर्जन के राष्ट्रीय पुरस्कार से सम्मानित किया गया है। सिटी चैनल को मिली जानकारी के अनुसार यह प्रतिष्ठित सम्मान उन्हें राज्यसभा सांसद माया नरोलिया और बॉलीवुड अभिनेत्री रकुलप्रीत सिंह द्वारा प्रदान किया गया। डॉक्टर दीपक पुरी को यह राष्ट्रीय नवाचार पुरस्कार चिकित्सा और सर्जरी के क्षेत्र में उनके लगभग 3 दशकों के बेमिसाल योगदान के लिए दिया गया है। वर्तमान में पारस हेल्थ पंचकुला में चेयरमैन के पद पर कार्यरत डॉक्टर पुरी ने इस मौके पर कहा कि मरीजों के इलाज में आधुनिक तकनीक के साथ साथ एक किफायती और सही तालमेल वाली चिकित्सा प्रणाली का होना बेहद जरूरी है। चंबा के लाल की इस ऐतिहासिक उपलब्धि पर पूरे जिले में खुशी की लहर है।